Welcome back. Outagamie County is using more ARPA funds to help fund mental and behavioral health initiatives. Pillars, Inc. is receiving $1.5 million, and NEW Mental Health Connections is receiving $750,000. These grants part of a $2.75 million in ARPA funds that the county has set aside for behavioral and mental health programs in the county. And we're joined now by Kevin Engelbert. He is the Development and Land Services Director for Outagamie County. So how did this process unfold where you determine who gets the money?
Sure. Well, this started a couple of years ago in the early stages of the pandemic. Once the county knew that we were going to get ARPA funding, our department did a series of community listening sessions on different topics. So there was a session on economic development, one on affordable housing, one on childcare, and one on behavioral health. And those sessions were with our community members trying to identify what to do with this once in a lifetime kind of investment that we received.
So what was the criteria for determining, for those who applied for these grants, if that was the process, or the criteria you used to determine who gets the grants?
Sure. So it all started with those community engagement sessions, identifying where specifically. So if we have a category like behavioral health, well, what do we do with that? You know, it's a pretty broad category,
It really is.
and you know, how do we maximize our investment? So off of those conversations, we then developed grant guidelines to try funding a specific goal that the community and the county had. For example, we had two grant programs started, one for a triage center and one for a community connections program, which was training for community health workers. And one of the two was successful, that latter program. The first one, the triage center, we really didn't get a lot of demand.
Okay.
So we pivoted our approach with behavioral health for that.
All right, so you mentioned there it's kind of broad, and it seems it's a big umbrella. We talk about it on this program quite a bit, and it's a moving target, it would seem, right? Because problems are different, individuals are different, triggers are different. I mean, for example, we just recently had the Surgeon General of the United States say that, in his opinion, they should put warning labels on social media apps. So things are changing all the time with this. So you mentioned you already had a project that didn't work out.
Correct.
How do you follow this money and make sure it achieves what you hope it achieves?
Yeah, so what we did is we repurposed it, and we had some conversations around the county about where our investment could be made that goes to organizations that are struggling to keep up with demand. And the two organizations we funded are Pillars, New Mental Health Connection, services that would help reduce the impact on the county. So if they no longer were able to provide their services, it would have a detrimental impact on us at the county. And then finally, we wanted to make kind of a transformational investment into these organizations. So instead of, you know, kind of divvying the money up so everybody gets a little slice, we wanted to make sure that we were funding a high target to be transformational in nature. And as far as the follow-up goes, for each grant award that we made, we were able to put in certain conditions that they maintain services at a level that we know would be beneficial for our community.
All right, let's talk about those benefits for the community, right? So you mentioned transformational for these programs. How does it then down the line hopefully transform and make it a better county, make it a better community?
Sure. So Pillars is our homelessness service, and they operate a day resource center. We know that during the pandemic, that day resource center has increased demand, up 40% year over year from 2022 to 2023. And so this investment will keep that center going. Absent this investment, one of the options that Pillars was looking at was closing that because they didn't have enough funding to keep that program going. For the New Mental Health Connection, they do a mental health navigator program, which acts like a triage program. And that, again, was at stake for being canceled without having funding to go forward. So hopefully these programs are kind of upstream prevention to help us keep up to speed with the demand for our programs.
All right, we've been talking about these two awards, but let's back out a little bit. Let's go to that 30,000-foot view, right? We're talking, these are ARPA funds that allow you to do this. You talked about things that if they didn't have funding, they couldn't sustain it. ARPA funds, although we hear about them all the time, this is not some bottomless pit of money, right? I mean, so can you give us a sense of how large the pit was to begin with and how close you're getting now to the bottom?
Yeah, so we received as a county $36.5 million. We are probably down to our last $2 to $3 million to allocate and find a home. We've been very careful and very judicious with our spending, where the awards we've made, we've set them up so they're at programs that either capital in nature, they're for a specific program that could last a couple of years and maybe close, or in the case of our last two awards, that they're money that can help those organizations plan and hopefully get ahead of their financial circumstances. But it is challenging with this one-time funding, knowing that in a couple of years we're not going to have that funding to draw on.
So does that really change the way you look at this last few millions of dollars? Because it has to go to a place, maybe you prop them up, whatever the organization is or whatever the project is, but it has to be sustainable after that because they can't come back for more.
Yeah, and it takes certain options off the table, programs that you would want to start that don't have other funding to maintain it in the future. You know, one of the questions we always ask of applicants is, how do you plan to take this into the future? So what's the plan when ARPA funding isn't there anymore? And we have had to say no to grant applications because they haven't had a great plan of how they're going to keep the program going into the future. And so for us, that's a major component of what we look for.
Well, Kevin, we appreciate the time, and good luck with the remaining few $1 million you have.
Great, thanks for having me.